Good morning, how are you? I want to speak about the anatomy of the skin. The skin consists of two layers, the epidermis and the dermis. And there are some adnexa. The epidermis is, in general, it is stratified, keratinized, avascular. It consists of a lot of layers, like stratum germinativum. It is the basal layer. It consists of hemodesmosis, connect basal cells to basement membrane. Melanocytes produce melanin, which is phagocytized by surrounding keratinocytes. The other layer is, we spoke about stratum germinativum, and there is a stratum spinosum. Desmosomes connect cells, creating a spiny appearance. Then the stratum granulosum, cytoplasm contains granules that later contribute to keratin. The other layer is stratum lucidium, layer of dead cells without nuclei. Then the stratum corneum, nearly a cellular layer of keratin. In general, in Arabic ممكن تكون توزيع غير أو الأسماء غير حسب استحالة أو تحول الطبقات. بنكون مولدة ومالبيكي وحبيبية ونيرة وقرنية متوسفة. هون حكينا عن جيرميناتيفوم اللي هي البيزل لاير، وعنا السبينوزوم، وعنا الجرانيولوزوم، لوسيديوم، وعنا الكورنيوم. The other layer is the dermis, which consists of the papillary dermis, superficial thin layer of loose vascular tissue. So, papillary dermis is superficial thin layer of loose vascular tissue, and the reticular dermis, deeper layer of dense tissue, less vascular. Then the fibroblasts, adipocytes, macrophages, collagen, and ground substances are present. Contains sweat glands, hair follicles, sebaceous glands, nerve endings, and blood vessels. Blood vessels enter the dermis from the subcutaneous tissue and branch into subdermal and subepidermal plexus. There are, as I told you before, there is adnexa, there is hair follicle, ingrowth of epidermis into dermis and subcutaneous tissue. Associated sebaceous glands secrete into the hair follicle. Retained in thin split thickness skin graft. And there are the eccrine sweat glands and the apocrine sweat glands. I wanted to speak about the anatomy of the skin, to speak about the eccrine and the apocrine sweat glands. The eccrine sweat glands, coiled secretory structure in subcutaneous tissue with a single duct passing to the surface. Decreased or absent in skin grafts, leading to dryness. So if we want to make a skin graft, you will see the number of the eccrine sweat glands are less or absent. The other kind is apocrine sweat glands, found in the axilla and inguinal regions, secrete into hair follicles, become active at puberty. All adnexal structures are sources of epithelialization in partial skin grafts. The collagen in general, is the most important structure, not only of the skin, of all of the body. There are 13 types. The predominant types are as follows. Type 1, which is available in skin, tendon, and mature scar. Type 2 it is found in the cartilage. Type 3, it is found in blood vessels and immature scar. Type 4 it is available in basement membrane. That's all about the anatomy of the skin. Of course, there is procollagen, which is a single chain of amino acids, and there are tropocollagen, which are 3 collagen chains bound by disulfide bonds, forming a triple helix, secreted by cells and combines to form filaments. Filaments combine to form fibrils, which combine to form fibers. Vitamin C, which is a ascorbic acid coenzyme involved in hydroxylation of proline and lysine, the amino acids involved in cross-linking collagen. That's all about it. Sometimes I try to give educational information. It is related maybe to some of the patients, or it is related to how do we think about disease. That's all, Dr. Bassem.